Hi, I'm Dr. Deepti Jain, and I'm a spine surgeon. I take care of thousands of patients every single year. In this video, I'm going to talk about what's called cervical myelopathy. Myelopathy means dysfunction of the spinal cord. And so cervical myelopathy means that it's stemming from the cervical spine. So as we get older, in general, our spines tend to become arthritic. And sometimes that arthritis can actually push on the spinal cord. So when the spinal cord gets pinched, it tends to malfunction. The word cervical myelopathy relates to a clinical diagnosis. That's the clinical presentation. Spinal cord pinching, what we call stenosis, central canal stenosis in the cervical spine, is what we see with our eyeballs on the actual MRI. And so if someone has spinal cord pinching on their MRI, they can develop these signs and symptoms of spinal cord dysfunction. Spinal cord dysfunction is concerning, very concerning, because it can often be irreversible. And so we try to pay a lot of attention. So if I see someone who has a lot of spinal cord pinching in their cervical spine, I pay a lot of attention to those signs and symptoms of spinal cord dysfunction. So what can that present as? It can present as numbness and tingling in the hands, sometimes also the feet, but more typically the hands. It can present with issues with fine dexterity. So what that means is feeding yourself if it's super severe, or issues buttoning buttons, or deteriorating handwriting. These are all symptoms that indicate that the spinal cord is not functioning. Other clinical presentation parts can include difficulty with balance. So normally people can do what's called a tandem heel-to-toe walk. That means that we walk heel to toe. And in patients who have spinal cord dysfunction, that can be really challenging. As spinal cord dysfunction gets worse, patients actually lose their ability to ambulate. So whereas they before might not needed a cane or a walker, someone with severe cervical myelopathy can actually require first a cane, then a walker, and then even a wheelchair. So having cervical myelopathy is a really big deal. And so it's really important to pay attention to signs and symptoms of it and seek medical attention if you're experiencing these symptoms that I described. I'm Dr. Deepti Jain. If you like what you're hearing, hit the like button and also subscribe. And we deliver new information about neck and back pain every day.